But
Well, if
will
you
you guys be?
remember,
Oh, okay.
because we do record it, so it won't be available for you, uh, for later on if you decide that you wanted to go back and re-listen to it. Now, let me see if we can do this. Voila. Okay. All right, I'm gonna try to change the screen over here so I can see everybody, and I can also see my presentation. Okay. So probably Jenny is the only one that does not know me, because I don't think we ever had the pleasure of meeting even in cyber. But a little bit about my background. I'm a board-certified naturopathic doctor. I'm an homeopath, as I mentioned it. I also did the level 1 and level 2 with Christine as a certified recovery nutrition coach. I do meditation groups that I lead every other week in one of my offices. So mindful meditation. So I'm a meditation facilitator, and I also do I'm a Reiki teacher, Reiki master, and I do biomagnetism therapy. So in the holistic approach, as all of you already know, we take in consideration when we look at health, we look at the overall of mind, body, emotion, spirit. So that's really the approach that I like to take. And one of the branches of holistic medicine, as I mentioned before, is homeopathy. So homeopathy is one of the most widely practiced branches of holistic medicine. It is used pretty much all over the world, but in some countries, is used primarily as an holistic approach, like in Europe, India, and some of the South America places, in France, Germany, of course. And as I mentioned before, it covers the whole sphere of mind, body, emotion, spirit. So it is, when we look at the picture, we are not doing things just symptomatically on the physical plethora of the symptoms, but the whole complexity of the individual. So it is unique that it is patient specific instead of disease specific. You'll notice, and if you already have seen it in the Materia Medica for homeopathic remedies, when we look at a disease in there, we might have several remedies, sometimes hundreds of remedies, because it is really, we needed to narrow down to the specific for the individual. And each individual will show up with a different picture that makes up the totality of all the symptoms. Jenna mentioned before about knowing that homeopathy is like cures like, from homeos and pathos. Those are two Greek words that basically have the theory that when you give a medicine, when you give a substance to a healthy individual during a proving, and this is how we make up our materia medica during the provings there. But when you do that, you collect all the symptoms, emotional symptoms, mental, physical, and it's a collections of all these symptoms that we term as a proving, that we know what this remedy is used for. So there may be a little, I don't know if it's clear or not, but if there is any questions, I'll be glad to explain them later on. But just imagine that if there is something that if you were to take it, it will cause you something like a headache or nausea, in small homeopathic dosage, which have been highly diluted and triturated, when you take the same substance and you are experiencing those symptoms that I mentioned, for example, nausea or headache, it will, once you match the picture of the symptoms with the remedy, it will be used as a catalyst for your body to cure or to treat those particular symptoms. Okay, so I've used it for alcoholism, and since for the Alliance, we deal with substance abuse and addictions, and we have seen very good effect with the homeopathic remedies that will help mitigate the alcoholism and also helps in rehab. So if you were to look in the Materia Medica for alcoholism, and you'll see that it will be under the sections of mind, you'll see alcoholism, dysmania, and there would be something like 178 remedies. So the idea is, how do you go by selecting the remedy that it's most similar to what the patient or the client is showing up with? Well, we try to match the remedy with the symptoms of the person that it's in front of you. And in a case, we'll look at his emotional, physical symptoms. We'll look at the whole picture. And one of the first remedies that we used in the early phase of withdrawal and the early phase of detoxing is aconitum. Aconitum, usually the people that need this particular remedy, they'll show up with heart palpitations. They'll show up from a fear of giving up their substance. So they're very reluctant of giving up their substance, their addictions, because of a fear that shows up that things are not going to work out well once they give up their substance there. Some of the other things that are typical with the aconitum remedy are sudden panic attack, again, strong fears, heart palpitation, shortness of breath. Usually they have a flashing of the face, so it shows up with some redness. They will faint easily. They experience painful urinations, lots of anxiety, throbbing headaches. These are the type of individual that have an unquenchable thirst, so they can drink water all day long and still feel that they're very, very thirsty. And some of the other symptoms that show up, some of the other interesting facts that we see in these particular patients is they don't like to be touched. Okay, they have such a profound fears that pretty much drives them nuts, and they are so fearful even in the future. They almost can tell you the day that they're going to die. So they don't like to be with people. In fact, there is more of a agoraphobia. They fear being with people. They even fear crossing the street, going outside. So there is lots of nightmares, anxious dreams whenever they can sleep, because they usually are more in a sleepless kind of patient. So the aconitum, by the way, all the remedies that we use in homeopathic materia medica, they're all in Latin. So when you see aconitum, it is aconite, or actually known as monkswood, and this is what the plant will look like. Okay. Another remedy that is used quite a bit in addiction is nux vomica, and this is really a great anti-alcoholic remedy. We start seeing that these people usually go into their DT, their tremors, headaches, very little noise will frighten them So they'll jump up even if they hear just a slam on the door or a bell ringing. That these are the ones that get frightened by, little small things like that. They pretty much can find rest in any place. So they'll spring up even in the middle of the night. They'll get out of bed. They'll walk around. They'll just up and down most of the time. Even if they're watching TV, after a few minutes, they'll get up, they'll walk around, they'll sit down again. So they are very restless. And when you see someone showing up with these kind of symptoms, think of Nux vomica. Nux vomica, this is what it looks like. It's a poison nut from the tree, strychnine tree. Yoshiamus, this is another one of those remedies that has been used forever, along with several others in the treatments of addictions, especially early stage of alcoholism and as well as other addictions. There is a delirium that goes along with it. The people are very loquacious, so they're very talkative. Their skin feels always cold, always clammy. These people are constantly picking at objects, even if there is nothing, but they'll have visions and there are things out there that they need to grab. They're terrified of just about anything that happens to them, which of course this is also going to create an insomnia issues for them. And they are usually alternating between laugh and weeping. So sometimes you see these people laughing out loud for no reason. A few seconds later, they might be bursting out and crying or weeping. So when you see someone behaving like that and having those kind of symptomology, like the small pulse and the clammy skin and cold skin and the DT, think of Yoshiamus. These people also tend to be more quarrelsome. They tend to argue a lot. They're very suspicious of anything and anyone. These are usually, they're not very easy even to show up in your office unless someone physically grabs them and takes them there, because they are not the type of people that will do this on their own. So if you come across an addict that shows up with this kind of symptomology, whether it's mentally as well as physically and emotionally, think of this particular. This is what it looks like. In English, it's called a henbane, and it's a pretty flowers from where the remedy is taken from. Belladonna, most of you have probably heard at one time or another about belladonna. It's also used in flu where there is high fevers, and the children benefits a lot, especially infant, when you start getting with high fevers, very reddish and pupils that are dilated. But this is also excellent for the feverish withdrawals of not only alcohol, but also heroin addict, some of the other hallucinogenic, LSD. So belladonna has a lot of delirium that goes along with it. They're very sensitive to light. They usually appear confused, and they always complain of having a dry mouth. So regardless of how much they drink, the mouth feels dry all the time. The belladonna is known as the deadly nightshade in English. There is a picture of it. And interesting enough, in older days, there was a hospital, Charles B. Towns Hospital, right by Central Park. Valsa, you live probably not far from there. So if you ever walk around that area, you might remember that, or at least now you can recognize that a long time ago, around 1920, or this hospital was there and was using some of the Yoshiamus and belladonna to treat alcoholism and drug addictions. The only interesting things that they were doing there is that they were using it, those remedies as a mother tinctures rather than remedy as holistic homeopathic remedy. So often, because they were not diluted and they were as a tinctures, it would cause more of a reactions of vomit, tremors, and other symptoms that are known to cure. But this hospital was doing this, like I say, at the turn of the century for decades in the New York City area. Opium in the homeopathic dosage is also used quite a bit as the old sinners. These are people that keep having their DTs over and over again. There's also here lots of terror. They're very frightening. They have visions of animals. They see ghosts and they see animals that jump up to them by anywhere. The sleep, of course, is very uneasy. They have a very stertorous breathing. You know, they have like almost like a snore, like a gaspy sound. And they also have symptoms that a lot of times will simulate a stroke, apoplexy. Opium, you know, it's from the opium seeds of the plant here, the poppy, the poppy, Papaver somniferum. Actually, somniferum, it means that it indicates as something that produce sleeps, produce that somniferum effect. Stramonium. Stramonium is also used a lot in the habitual drunken people. They also have animals coming in them from every corner and they try to escape, but their face is really white red and not dark red as we've seen in the opium. So that's one of the indicator that hopefully you'll remember if you're trying to decide between a stramonium and an opium. You know, even though they both have the vision of ghosts, but in this case, they have more nervousness. There is more of a quickness, and the stramonium is red instead of a dark red, as we've seen in the opium cases. Stramonium, it's also known as the Datura stramonium. It's a thorn apple, also another English name for it. This is what the picture of this remedy looks like. One other great remedy, and it's used quite a bit in our materia medica and quite a bit also for addiction, is lachesis. Usually what you see with the lachesis is that are very, very good in hiding their addictions. Often, even their close friends or relatives don't even know that these particular people have an addictions because they are so clever in hiding it. So it makes it very difficult for someone, even a spouse, may not at first recognizing because of how well they hide it. These particular people, though, are more inclined to violent crimes. Those are the more vindictive, the more violent. They're very loquacious, very talkative, whether before they start drinking or once they go and start getting drunk. These are usually the people that you see drunk at home or at the bar that getting very belligerent. Unlike some of the other drunk people, some of the other substance addicts that tend to be more on a quiet, sedative stage. These people are known to pick a fight. They're known to be very violent. There is usually a choking sensation that they feel in the throat. And a lot of times they'll even get up in the middle of the night from sleep because they feel like that they're choking. Often these people, you see that they can't stand wearing anything around their neck, even a scarf or one of those sweaters that comes all the way around their neck. They don't like anything that pretty much gives them the sensation that they're choking. So if you know of a patient or a client that uses the substance and or you might not even know that they're using it because they're so good in hiding, like I say, and it makes it difficult for people, but you see other symptoms there that depicts the picture of the lachesis. The lachesis is known as the bushmaster, is a highly poisonous snake, but they draw the remedy from the blood of the snakes, and it gets highly diluted and triturated in order to make it an homeopathic formula. Okay, another one is acidum sulfuricum. This is the sulfuric acid. It's taken from sulfuric acid. This is a good remedy for the chronic alcoholism people. Usually, unlike the other ones that we're seeing with it, either a bright red or a dark red face. These are usually pale. They're shriveled. They're cold all the time. They cannot tolerate any food or any water. In fact, even if they got to drink water, they have to put some whiskey or some brandy in there because otherwise they would not be able to tolerate the water either. So there is a lot of sour breath, vomiting with this particular type of people needing this remedy. Chimichifuga is another one of those remedies that it's used a lot in addictions. These people usually show up with mental depression, lots of tremors. There's delirium, is mild, but there is hallucinations that it's related to small objects. They may even be the one complaining that they see ants crawling on them or little things moving around. Unlike the other, they have big animals and ghosts that we've seen in the previous remedy. The Chimichifuga people don't complain of those kinds of complaints there. However, there is a insomnia that it's pretty persistent with them. And insomnia is probably one of those things that you find in lots of your addictions, especially in the early stage or when they're coming off their detox. Seems like the falling asleep is a big issue. And again, insomnia is more of a symptoms because there are, as you know, a couple types of insomnia. Some people will have a hard time falling asleep, but once they fall asleep, they're still asleep for a while. Other people have no problem falling asleep, but they'll wake up a couple hours later and stay awake for a while. That's another type. And also, there are other people that will show up with both. They have problem falling asleep, and then finally when they fall asleep, they'll sleep for 30, 40 minutes, then they'll wake up again, maybe because of a fear or maybe because of nightmare or whatever, and then they have a hard time falling asleep. But so those are all type of insomnia that we usually see with addiction especially. Chimichifuga is also known as black cohosh, as a English that we see it as a herb. So this is what it looks like. Arsenicum album. This is another remedy used quite a bit. And these people are usually very anxious, but very anxious about their health. Okay, they are extremely obsessed about the details, the order, almost like an OCD type of behavior, where they have to have things in a certain way, and they need to be in control of everything. Otherwise, this too will cause them more anxiousness. Lots of panic attack with these particular remedies and they occur around midnight or the early hours of morning. Asthma attacks are also accompanied by the anxiety, digestive issues. So these are people that also have an unquenchable thirst. And unlike the other ones that have more of a dry mouth feeling, these people don't complain of a dry mouth, but they just complain that they're thirsty all the time. They start getting very fidgety, very restless. They need to change place continuously. And this is also known as the anxiety, also known that's triggered by alcohol as well as tobacco. So the arsenicum album is the white arsenic, and it's another one of those minerals found in in nature. But of course, it's arsenic, as we know, is a poison. But once you make it into an homeopathic formula and you triturate it and dilute it so many times, then it will help you heal the symptoms that would have caused otherwise. Pulsatilla is also used quite a bit. These particular patients express their anxiety as insecurity, unlike the ones that we've seen before, where they don't want to be with people, they want to be left alone. These people are totally the opposite. They are more of your clinginess. They need constant support, constant comforting. These are the people that want to be held. They get discouraged easily. They get very moody. They're tearful all the time. And they're constantly changing their mind, almost like a childish type of mind. You know, you're there with them and they'll ask you to do something or get something. Then 5 minutes later, they're changing their mind and they want something else. But one thing is certain, they don't want you to leave them. They want your constant support, your constant comforting. They want to know that you're there, physically there all the time. Usually these people, another one of those characteristics is that it gets worse, with their anxiety get much worse after getting too warm or if they're in a room that it's stuffy. So if you see that someone that does much better with a fan or needs to have a constant fan or a window open all the time, even in the middle of winter, just think of, and they also show up with that clinginess, insecurity, and childlike mood. Think of pulsatilla. Pulsatilla is known as the windflower, and probably because it moves around depending on the directions of the wind. So we often pictures a patient changing their mind just like as the wind would blow from one direction to the other. So those are your typical pulsatilla patients. Some of the quotes, because homeopathy has been used, like I say, for hundreds of years and by many people. The Queen, Elizabeth, was known to always carry homeopathic kit with her. Paul McCartney was quoted by saying that he can manage a life without homeopathy. Every place he went, he always took some homeopathic remedy, and he used it quite often. Gandhi was also known to be a big promoter of homeopathy. And again, because it is safe, it is inexpensive, it is easily accessible. So it makes sense that a lot of people will at least look at them. Some of the, in the Alliance we have, if you go on the website, there is lots of good resources, books from Julia Ross, one of our pioneer and founding individuals of the Alliance. So her books are there, The Treatment for Addictions, but the ones that I've referred to it in this particular forum are the ones that were more indicative of homeopathic and the way homeopathic deals with addictions. So I just put a few there for our own, for our own looking and in own interest if you wanted to look any further with that. So I wanted to now open up for questions, answer, comments, anything that that we can go over. I'll be glad to. Any questions, any things that at all that we didn't get cleared up, this might be a good time that if I can answer. Please.
Thanks, Salvatore. Each time you do this, I understand a little bit more, but I think I need you as an advisor to actually just deal with clients, and then maybe, I still find it to be very complex, even though I understand some of the individual agents you're talking about, just in practice,
Yes.
I think last time you mentioned this questionnaire, right? Like you give this questionnaire, and then I guess it'd be interesting to see, with the questionnaire, if you can predict what kind of.
So on the questionnaire, I mentioned briefly last time because we really ran out of time and we went in 30 minutes overtime. So I didn't want to make the same mistake this time. I want to give ample time. But in questionnaire, I will ask because the way you determine the remedy, which remedy is the most similar for your patient, is by determining all the peculiar things. For example, with the cases, it isn't just the fact that they get violent as a result of their addictions or what they're using, but it's also the fact that they don't like stuffy room. They don't like even a scarf or anything around their neck. They feel that they're choking. So when I ask questions, for example, what makes it better? What makes it worse? They have to have a constant fan, or maybe they have to have a heater all the time, or they're okay in sunny environment versus a stuffy environment. They feel worse during a storm, like a thunderstorm versus, or they feel much better if they are by a sea, or if they are up in a mountain, or if they walk around by themselves, or if they take a walk with friends, with people. And they don't have to be friends. A lot of these pictures of homeopathic people, they just like companionship. They just like to be around someone just so they don't feel that they're left alone. And others will just seek places where they know that they will never run into anybody. They'll go on this walk where they're pretty much guaranteed that they're going to be the only one on the path because nobody else takes that path because they don't want to see anyone or deal with anyone. So those are the peculiar things that are to the individual that are the determinant factor sometimes of, if you're looking at 2 or 3 remedies as well, this could be or pulsatillo. This could be lacases. Which one do I know? Which one do I know that I need to give? Is by looking at these other symptoms, in totality, and determine which ones they are closer to it. And remember, when we're looking at the remedy, Hahnemann always called the similimum, which means the most similar. So the most similar is the one that really gets us really closest to where we need to be. And those, it's not 100% all the time of all the symptoms, because most often people are not going to show up with all the symptoms that you read in the Materia Medica, but they will show up with the most majority of those.
So in this Materia Medica, do they list symptoms like against each remedy? So you have the symptoms. So like
Yes.
I guess a big category is, say, anxiety, for instance. You gave that. So you have anxiety and they have a list of symptoms. And then it's almost, again, I think I used the same analogy last time, like a Chinese menu, right? Like you sort of say, all of these symptoms are present.
Uh-huh.
So that this is so
Yes.
this the remedy, and this is the most similar to what's ailing the individual. And so,
Exactly.
okay, that's interesting. And then how do
Exactly.
you know the dosing again? The third, you always start with the 30C, right?
So the dosing gets very again, that too is individualized, because if you ever seen, for those of you that have used homeopathic remedy, you'll notice that there is a number and then there is a letter, something like 30, and either a C or an X, or 12 C or X, or 200 C or X. So the first number is how many times the remedy got triturated and diluted. So in the 30, it means that it was done 30 times. The first time you get the mother tinctures, and then you keep diluting it 30 times from there. The letter corresponding next to the remedy, either the C or the X, stands for the Roman numeral, either X for 10 and C for centesimal hundred. So if we have a remedy of 30x, that means the ratio used was a 1 to 10, so 1 part of mother tinctures and 9 parts of your carrier, which can be, sugar pills, lactose, which could be glycerin. So you do 1 to 10, and you do these 30 times by picking up 1 more drop from these and 10 more of the other. And that's how you come up with a 30x. And if it was a 30C, the ratio is 1 to 100. And once you have done this, the higher the potency, so the higher the number, means the stronger the potency. But if you are dealing with a patient that it looks weak emotionally, physically, and otherwise, you don't want to start with something above 30. You won't want to go with a 200, which is a very strong remedy, because they may react differently. Okay, instead of help them getting better, they might feel much worse at first, because it's almost like too much for their body to take in at once. So rule of thumb, if you go with a lower remedy, you really can't do any damage and can't
Oh,
make
so like
anything
a
happen.
6, right?
Like
So
a 6, yeah.
if you have an option between C and X, do you go
Mhm.
with a C then?
Yes. In that case, I will go with a C, because at least the ratio is 1 to 100. So I'm getting even less of the mother tincture. And then the other thing to keep in mind is, the lower the number, the more closer to the physical symptoms you deal with it versus the higher number that are more for their mental, emotion, and spiritual symptoms. So if we are dealing with something that it's totally physical, okay, then you can probably do a 6 or 12 because they are not coming up with any emotional symptoms, which doesn't happen very often because, usually there is always some emotion, something mental associated with it. But it is to what degree they are showing up as. Maybe their emotional are not in this particular case as strong as their physical. So we tend to give something that will resonate more with their physical in this case. Voss,
So
I
it's the
think you're
lower,
muted.
sorry, so it's the lower
That's,
number, like 6, and then you would go with a C, for instance, if it's more physical.
yeah.
And if there's more of an emotional component to what's going on,
Then you
then
started
you would like a 30, and then you would
mm-hmm.
choose perhaps an X. I mean, you can do still a C, but you might go with an X.
An X or even
I
a
think I'm
200 if you start seeing very strong emotional coming out. Then you can go with a 200, you can go with LMs, and those are the very high potencies.
okay. So when you see someone, an individual, how long does it take before you assess the person and then decide on a remedy? Does it take you half an hour, an hour? Does it take you 2 hours?
So usually my initial consultation is about an hour and a half to 2 hours.
Mhm.
Okay. And during that time, some of those things will show up because it isn't just from the intake, but I will also see from their facial, the non-verbal language that they're showing up, as well as their anxiety or their frigidity or they falling asleep, over here in my chair, what else is going on. And so all those things I will take into consideration, okay, and make a note. And then I will look in the repertory, which is the software where I collect all these symptoms, physical, emotional, spiritual, and everything else, dump them all in this database and start eliminating and start narrowing down to the remedies that I would choose. By the time I get 2 or 3 remedies left, I will look at those individual remedy and see which one of those is really the most similar for this individual.
So you have 2 sessions. So the first session is assessment, and then you see the individual, the second session, and you give them the remedy.
Yes, yes, yeah.
And
It
then how
isn't.
long? Okay.
Oh, go ahead.
No, you should go ahead.
I was going to say it's not very common to come up with a remedy right there and then. At least unless you do this 24 hours a day. I mean, there are some homeopaths that, especially if you do it on the physical side, it's a little bit easier because you can recognize some of those symptoms easier than when you're trying to put it all together in a picture of mind, body, emotion, health, spirit, to come up with the whole health. So that's when it takes a little bit more time to determine the right remedy.
And does this all, like, because you talk about physical, is this all like in person evaluation, or since COVID, have you been able to do it remote?
So I've done some remote, but I will tell you, I lose so much when I do things remote because part of the part of the determinations of remedy is how they show up. Okay, how they even walk into my office, how they sit, what kind of posture they take, what kind of gesture they might be making. Are they sweating? Are they cold? I mean, you see so much when you see someone in front of you that doing it on the little screen 12 inches. I mean, it really doesn't explain, and doesn't, you lose so much of them that I don't like to do that
Yeah.
via a Zoom because a lot of my uh, a lot of the symptoms, a lot of the uh, determination of what I will get from it, it's it's given right there and then from the patient. Even their end gesture, even the there's a lot of them that you can uh, assimilate by having someone there versus looking at the small screen. Or worse yet, one of them that I had to do it, that the person didn't even have a computer, so was just on the phone, and you don't even you can't even tell what this person looks like. So you're
Right.
really trying to uh, determine something in a difficult way.
And if anyone else has questions, but but can you come up with a protocol, like say someone with an alcohol use disorder? You talked about, some of these remedies. Can you just like, how we use amino acids? Can you
Mhm.
come up with a protocol like for alcohol use disorder? These are the agents that you can consider, and for um
Yeah, and what I
like
do
uh
is the protocol is pretty much like I was saying, for the remedy. It's okay. Uh, are they red face or pale face? Are they uh, sweating, or they feel that being in a room that it's stuffy is making them more anxious, or is making them better? So that's basically the protocol that that I get, or that I come up with it, and helps me determine, just like with the amino acids, are they scoring 10, are they scoring 5, and then when you add it all up, you come up with an amino. In this case, when you add those all up, you come up with a remedy.
no, I was saying that maybe you can come up with a protocol like for low serotonin, low cap, maybe not like
Oh,
that. Maybe no, not necessarily for amino for the neurotransmitters, but just trying to think. Anyway, just like maybe
that might be
anxiety.
that. Yeah, that might be something that because again, when you look at anxiety in the materia medica, there is hundreds of
I know.
remedies that will come up. So it's determining from there which one fits the person in front of you, that will help you and help them with the anxiety. And in the older days, this was done by looking each one of those rubrics in the repertory and writing down the remedy and then collecting it. Now there are some very good, powerful softwares where they have collected all these things. And all you have to do is sort of fill in the blanks and say, okay, anxiety in the morning, or anxiety worse in the afternoon, or better with company, or worse with friends. And so you started putting all these things together, and remedy comes up. So it's
Thanks.
not as tedious uh, and taking days like you used to do it before. Anybody else? Is there any questions, comments, or maybe if you used any of the homeopathic, even if it was not for addictions, but maybe for your children or your pets, and it's used quite a bit on horses, cats, dogs. Uh, so there is a lot of people around the world that have used these remedies for various things. If you had any experience or anything that you'd like to share, uh, please do so. It's a small, intimate group, so we don't have to be very shy. We're not speaking an audience of 1,000 people here. And if there is no other questions, I wanted to thank you for joining me this afternoon. I hope you like what you see that the Alliance is providing. I would encourage to take a look and become a member in several different levels that we offer, because there is a lot of material and a lot of practitioners that do awesome work with different tools. And in my opinion, I was mentioning this last week to Julio Ross. In my opinion, the more tools we have in our toolbox, the better job we can do for our patients, for our clients. So, if we can enrich ourselves with all these modalities, then I think everybody will benefit. And if there's no other questions, I wanted to thank everybody for joining me. Again, have a good holidays, Thanksgiving holidays if you're celebrating, and hope to see you in one of these forum or roundtables if you're a member. Thank you.
Thanks, Salvatore. See you
Thank
soon.
you. Take care. See you. Bye-bye.